Hi, my name is Alex Smith. Lauren Cook is my videographer and Bailey Mills is my evaluator. This is going to be my simulated med room, which is going to be separate from my patient's room. Before I head into the med room, I'm going to be checking my provider's orders, and I'm going to be working with Mr. Jamie Wheeler today. We are going to be giving him 3 medications, digoxin, vitamin B, and an insulin, Levemir. Because the insulin is a high risk, I'm going to be verifying that with another RN. And with his digoxin, I need to know ahead of time that this medication is held if his heart rate is below 60. For this simulation, I will not be taking his vital signs, but if in the real world, I would be taking it before I give it to him. And I have his vital signs here. His heart rate is 75 and his blood glucose is in range where he should be getting his insulin. With that noted, I'm also going to double check allergies and anything that contraindicates any of these medications, and I don't see any, so I'm going to go into the med room. I'll wash my hands, and I'm going to start verifying my medications against my MAR. So the first medication we're going to be giving, I'm going to get a glass of water, is the 250 micrograms of digoxin. His heart rate is within limits for this. He will not be holding that. 250 micrograms correlates with 0.25 milligrams. So I'm verifying the correct dose, correct route by mouth, correct medication, correct patient, and correct time. It should be given at 0800. And for this case of the simulation, we're just going to pretend that is right now. So correct time. There's my 5 for that. For the vitamin B12, we're going to be giving 1,000 micrograms, which is 1 milliliter. So I'm going to verify the correct medication, correct dose, 1 milliliter, correct route, intramuscular, correct patient, Jamie Wheeler, and that was ordered now, so the time is correct on that. And then for the insulin, we need correct medication, correct dose, 10 units. It's going to be a subcutaneous injection, correct patient, and that is also for the simulation going to be at 0800. And because this is a high-risk medication, I'm going to ask my second RN, Bailey, to step in here and verify this with me. Okay, so we are giving Levemir to Mr. Jamie Wheeler, 10 units subcutaneously at 0800. Perfect. Thank you. So I verified that with the second RN. And before we continue, I'm just going to double check the expiration dates on all these to make sure we're not giving any expired medications. Okay, nothing is expired. I'm going to gather the rest of my supplies. And before going, I'm just going to double check everything one more time before I enter the patient's room. So digoxin, right dose, right patient, right route, right time, vitamin B12, right medication, right dose, right route, right time, right patient, insulin, right medication, right dose, right route, right time, right patient. Okay, I have all my supplies. Hi, Mr. Wheeler. My name is Alex. I'm going to be your nurse today. Before we get started, can I have you verify your name and date of birth, please? Okay, that corresponds with what I have on my documentation. Before we get started, I'm just going to provide you with privacy. I'm here today to help to administer some medications for you. I have 3 of them that your doctor has asked me to give you, and I'll explain all of them as we go and give you a little heads up about what you should be looking for with each medication. Before we get started, I just want to confirm, what are you allergic to? The patient confirmed they are allergic to codeine, which matches my chart. Okay, so to start, we're going to be giving you your digoxin, which is an oral medication, so I just want to confirm that you are able to swallow. Pop over here and get gloves, sorry. Okay, patient is able to swallow. Okay. So with this medication, this is for your heart, for your atrial fibrillation. So this is a high alert medication, so I'm going to be checking in on you periodically throughout this afternoon just to make sure that everything's okay. If you notice any changes, if you start feeling a weird heart rate, cold, dizzy, anything along those lines, please don't hesitate to call me. In the real world, you would take the apical pulse for 60 seconds on this medication before administering this medication, but in the simulation, I will not be doing that. Okay, so I'm going to complete my last 5 rights check. So this is Jamie Wheeler, digoxin, 0.25 milligrams, correct time, correct dose, correct patient, by mouth. Okay, I'm going to go ahead and open this. Okay, Mr. Wheeler, I'm going to stitch you up just a little bit more. See that you can correctly swallow this. Okay, here is your pill and some water. And I'm going to verify that the patient swallowed both of those. Okay, perfect. I'm going to lay you back down now, get you comfortable. Okay, so our next medication is a vitamin B. So this is going to be a shot in your upper arm. I'm going to go ahead and lift this. Perfect. Yes, I'm going to be doing this in your deltoid. Just to give you a heads up before we do this, this is to help with your metabolic process. And you may have a little pain at the injection site, but other than that, there should be no side effects. If it is painful, let me know and we can handle that. Before I draw up the medication, I'm going to verify my last 5 rights. Vitamin B12, correct medication, correct dose, 1 milliliter, correct route, intramuscular injection, correct patient, Jamie Wheeler, and the order said now, so that is the correct time. For this, I'm using a 3 milliliter syringe. And I have my blunt tip needle here. Okay. And because this is a multi-use container, I would be cleaning the top of it for a full minute. For the sake of this simulation, I will not do a full minute, but I will clean this. Okay, that's good. Okay, so I would draw back 1 milliliter of air, remove my cap, insert it into the jar. Okay, inserting the air. And now I will draw back a full 1 milliliter. And I'm going to go a little bit beyond the 1 milliliter because I do have an air bubble in there.
4 milligrams.
I'm going to draw back the needle more to get everything out of the tip. Dislodge any air bubbles. Okay. Push it back up to get the air out. Perfect. And I have exactly 1 milliliter. I'm going to use the scooping method to recap this needle. Unscrew this. There we go. Okay. That goes in there. Okay, so we're going to be doing this in the deltoid area. So I would measure, find this bony landmark down. I'm going to go right here. I'm going to start cleaning at the center and working my way outward in circular motion. And then I'm going to leave this as an indicator of where I'm going to be giving the injection. I have gauze in my hand ready to go. I'm going to be using, because this is an intramuscular injection, I'm going to be using a 23 gauge needle, which I just verified. Okay, Mr. Wheeler, disengage my safety. You're going to feel a little pinch if I do this. Just a reminder, it should maybe a little bit painful later, but it shouldn't be too bad. I remove my cap. Because this is an intramuscular injection, I'm going to be using Z-Trap, pulling laterally. Okay, Mr. Wheeler, a little pinch. 1, 2, 3. And slowly push the medication in. Okay, the medication is in. I'm going to count to 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. I'm going to release my tracking, withdraw my needle, put the gauze on. I'm going to engage my safety using a hard surface and put this in the sharps container. I'm going to get this out of here and recover my patient. How are you feeling, Mr. Wheeler? We have one more to go and then we are done. So our last medication is the insulin. I'm going to do my last 5 checks. Correct medication, 10 units, correct dose. It's going to be an intramuscular injection, so it's going to be going in your abdomen. Correct patient, Jeannie Wheeler, and the correct time, 0800. This again is a multi-use container, so I will be cleaning the top. Real world, I clean it for a full minute. Right now I will not be doing that. Mr. Wheeler, with this insulin, I just want to give you a heads up. This is to control your diabetes. I'm going to be checking in on you to verify that everything is working okay as the day continues. But you may experience a little drowsiness, trouble sleeping, a little hunger, headache, irritability. If you experience any of that, please don't hesitate to let me know. Okay, so our order calls for 10 units. I'm going to be pulling back 10 units of air. Removing my needle. Yeah.
And then
Inserting this into the tube. Injecting the air.
Jamie Williams, erythromycin.
Okay, I'm going to draw back 10 units. Okay.
Subcutaneous on Tuesday, 600.
I'm going to pull everything out of the tip. Dislodge this little air bubble. Push the air out. Okay. Then to recap this. Okay. Okay, Mr. Wheeler, I'm going to expose your abdomen. So we're going to be doing this in the lower right quadrant. Okay, so it's going to be right over here. I'm going to be avoiding your umbilicus, your belly button. I'm going to start swabbing here, starting in the middle and working outward in circular motion. And then I'm going to leave my swab to indicate where I should give you the injection. Okay, waiting for that to dry. I'm going to remove my cap. Because this is a subcutaneous, I'll be pinching the area around while I'll be giving an injection. Mr. Wheeler, you're going to feel a small pinch. 3, 2, 1. And slowly insert the medication. All the medication is in. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Release the pinch, pull out, gauze on. Put this in the sharps container, along with my lids. Remove this from the patient and recover him. Okay, Mr. Wheeler, we are all done. Are you experiencing any pain right now? Wonderful. I'm just going to do some charting over here. So I would document the patient's heart rate, which came from his vital signs, and the location of all of these. These were given the time and the location. I would also document that the patient tolerated the procedure as well. He's not in any pain right now. Because these are high-risk medications, I'll be monitoring his blood glucose and heart rate within the next hour, and then the blood glucose for the next 6 hours. Mr. Wheeler, I will be back to check on you, but if you experience anything that's a concern or any discomfort before then, please don't hesitate to let me know. Make it situated. So lower the bed. The bed is lowered to a working height or a safe height. I'm going to wash my hands, and my patient doesn't have a call light, but if he did, I would give it to him and leave the patient's room.